COVID-19. COVID-19 is the very dangerous disorder. Nowadays, all are very unhappy with this COVID-19 disorder and also scared. Okay, COVID-19 is one of the villain in our. It is one of the present disease worsening disease condition. It's starting about 2019. COVID-19, it's coronavirus disease in 2019. COVID means corona, VI means virus, D means disease. 19 means 2019. The disease outbreak in the China, that is called. That's why it is called it as 2019 here. That's why totally we call it as COVID-19 disorder or coronavirus disease. Okay, today contents to be discussed are that's introduction about the COVID-19 coronavirus and structure of coronavirus and World Health Organization declaration and meaning of COVID-19, causes, risk factors, mode of transmission, and signs and symptoms, investigations, treatment, and preventive measures. Okay, this is about today class. First one, introduction. Introduction about coronavirus. See, coronavirus are a group of RNA virus. Okay, virus is divided into DNA virus, RNA virus. This is a group of RNA viruses. Okay, RNA virus that cause disease in mammals and birds. Mammals are human beings. Okay, mammals are human beings and elephants like that. The mammals and birds also. Okay, the name coronavirus is derived from the. It is basically the coronavirus is derived from the basically from the Latin word. Means Latin word from corona. Okay, corona, C-O-R-O-N-A, corona, meaning crown, crowning a breath. Itself they're borrowing, and it also it's one of the corona is coming from the Greek word that means in Greek language it means corona means garland. Okay, garland and crown. And the family of coronavirus is Coronaviridae, and phylum is Pisuericota, and class Pisonogryzides, and kingdom is Orthornovira. Okay, this is one of the introduction about the coronavirus. You have to know the only coronavirus is daily 1,000. The coronavirus disorder daily crosses 1,000, daily crosses 2,000. And one of the preventive measures: wearing mask, use sanitizer, and maintain social distance. That much knowledge is not enough for the medical professional and also nursing profession. This are the we have to know about coronavirus in detail. That is introduction. We have to everything we have to know of the medical medical professional overall interested to know about the coronavirus. This is a very good video for knowing about the coronavirus. See, this is a cross-sectional view. Okay, this is the zoom. I'll zoom that coronavirus. I'll zoom that figure and I'll zoom that this coronavirus picture like that, showing the cross section, like cutting the coronavirus, cutting the in middle, I cutting the coronavirus. How we cut the apple? How we cut the apple in 4 pieces? I'll cut only 2 pieces. Okay, 2 pieces, right and left. Okay, right and left. In the cross-sectional model of coronavirus, it's a spike. Say that we took like the pink color is called it as spike glycoprotein. Okay, spike glycoprotein and M protein and hemagglutinin esterase dimer HE envelope, and red color is called as envelope, and RNA N and N protein. N protein is number of proteins are present in the RNA, and E protein. Okay, see, this is one of the cross-sectional cut model of the coronavirus, and this is the microscopic view under the electron microscope. Under the electron microscope, the coronaviruses or virus, okay, coronavirus group of virus that have a halo shape and crown-like appearance when viewed under the electron microscope. Under an electron microscope, this is the how the coronavirus when you look under the electron microscope. It's the one of the picture. And as WHO declaration, World Health Organization declared the coronavirus is very disorder outbreak, and it's the pandemic in the month of March 2020. In the month of March 2020, World Health Organization declared COVID-19 outbreak, and it's the pandemic. Pandemic means it spread all over the world. It's the pandemic. The virus is known as the severe acute respiratory syndrome coronavirus 2. It also called as SARS-CoV, that's COVID virus 2. This causes is called as COVID-19 or coronavirus disorder. Now I explain the meaning, COVID-19 meaning. COVID-19 is a new strain of coronavirus. CO stands for corona, VI stands for virus, and D stands for disease. The formally it is another name for coronavirus, means it referred also to 2019 novel coronavirus, or some of the symbols. Some of the symbols are used in the, especially in the media, especially in the newspaper, especially in the something talking meetings. They are all using some keyword, and they are using some small words, COVID-19 like that, and 2019 NCOV like that they are using. Now I'm explaining what is COVID-19. Co means stands for corona, V stands for virus, D stands for disease, and also 2019 NCOV, that is called it as novel coronavirus. There is novel means new type of virus, new type of coronavirus that introduced by China. It's by China in 2019 in the November, I think so. November in 2019. That's why it is called as 2019 novel coronavirus. And as another meaning of coronavirus, it's the family of virus that can cause illness. Okay, after you know about the coronavirus name, you know the meaning of, now you get one idea what is coronavirus or what is COVID-19 and family and phylum and kingdom of its COVID-19. Then we are entering into the general meaning or basic meaning. It's the family of viruses that cause illnesses in the, for example, common cold or severe SARS, severe acute respiratory syndrome, and Middle East respiratory syndrome. In 2019, it identified as a cause of disease outbreak that originated in China. That's the basic meaning, and that's the basic cause, and that's the basic symptoms. Common cold, SARS, and MERS. Okay. Next, risk age groups. Yes, risk age groups. Okay, risk factors are overall at the high risk. Of this getting this coronavirus. The first one, the older people. Okay, that older people crosses the 60 years old. This picture shows that older people 60 years and above. And also with a medical condition, with medical problems, it associated with the problems of diabetes, cardiovascular disorder, chronic respiratory disorder, and especially the cancer. This is a major disorder. Person has experienced as person has the having some health issue is the high risk. And second one, risk of severe disease gradually increases with age starting from around 40 years, 60 years and above. First risk. Second risk is around 40 years. And also higher risk age groups are young children or infants or young children. Young children is below 16 years of age, young children. Okay. Adolescent and control. Next, mode of transmission. Yes, you know the mode of transmission is the person to person, okay, droplet. Now I give some clarity about what's the mode of transmission. Okay, for referring the data of the WHO data, and referring some information from the Google and some information from the net source. See, the mode of transmission, it's spread from person to person among those in close contact within about 6 feet or 2 meters. Okay, close contact, the person to person, it will spread, or it is the droplet infection. Okay, droplet infections. If the person having COVID-19 sneezes, it coughs, it talks, it immediately spread to someone who is not having any COVID-19. This is one of the mode of transmission. And these droplets can be inhaled or land in mouth of person nearby who are not having any COVID-19 or not having any coronavirus. The person is received, or the droplets, the infected droplets are inhaled by that normal person, that immediately start the COVID-19 symptoms after 14 days, after 14 days immediately. Okay, it can also spread if a person touches the surface with the virus on it, and then it touches his mouth, nose, eyes. See, this picture shows that this first one is the droplet infection. Droplet, mode of transmission, droplet. If the person coughs, sneezes, can spread droplets of saliva and mucus. And airborne disorder. Airborne tiny particles possibly produced by talking are suspended in the air for longer and travel further. Airborne disorder. And less than, see the structure of the microorganism or structure of the coronavirus is less than 5 microns. For example, I am giving the, for example, is droplets. Is, for example, human hair. Human person hair, that is 60 to 120 microns. For wide angle, that is 60 to 120 microns. Wide angle, you can see the wide angle. Compared to the human hair, compared to that one, the coronavirus, that is less than 5 microns. See the structure and see the example. Okay, less than 5 microns of the droplet infection. And signs and symptoms. Oh, yes, sir, we know the signs and symptoms. That's fever, cough, tiredness. It's only symptoms. We can manage, and cough. So when taking the syrup, we can manage. Okay, see. Once we start when know the entire COVID-19 symptoms, we have to know the treatment also. Now we will explain first one. I will explain the signs and symptoms. If today you contact with the person, or today you exposed to the COVID-19 patients, or to the surrounding area, or in airborne disorder in droplet infection, then you immediately not starting any symptoms, and you immediately not start getting any cold, any fever, any tiredness after 14 days, 2 to 14 days. That's the incubation period of corona. Showing the first signs and symptoms. Are you experiencing the first signs and symptoms by the exposed person? That is the incubation period. The signs and symptoms of coronavirus disease may appear in 2 to 14 days, 14 days after exposure. Okay, after exposure, that is called it as, that showing the symptoms is called it as incubation period. The main signs and symptoms are include fever, increased body temperature, or cough, or cold, and tiredness or fatigue. And major symptoms or early symptoms are loss of taste. Okay, loss of taste or loss of smell. And other symptoms can include shortness of breath, or difficulty in breathing, or muscle aches, muscular pain, and chills, sore throat, throat pain, or difficulty during swallowing, dysphagia, vodinophagia, runny nose. Vodinophagia means painful during swallowing, and dysphagia means difficulty during swallowing. That is caused by sore throat or throat pain, and runny nose, headache, chest pain, and pink eye. That is conjunctivitis. This picture shows that all the symptoms covered by all the symptoms of coronavirus. Okay. Next one is less common symptoms. These are the less common symptoms: nausea, vomiting, diarrhea, skin rashes. Okay, these are some of the less. You not the COVID-19 patient not experience this type of symptoms. These are less common symptoms. Okay, skin rashes. No, any skin rashes. The main thing is first one, early symptoms are loss of taste or fever, cough, tiredness. They are major and early symptoms. After these are the coordinated symptoms. These are some of the less symptoms. Less symptoms: skin rashes, nausea, vomiting, diarrhea. No importance. Next, as types, there are two types of mainly the COVID-19. This symptomatic and asymptomatic. I'm going to give the symptomatic. Okay, symptomatic means no person is having all this, covering of all these symptoms, including the fever, cough, including the early symptoms, and all the symptoms, early symptoms also. That person is called a symptomatic COVID-19 patient. Symptomatic. Asymptomatic means the person, some people may have no symptoms at all, no symptoms of no any fever, no any cough, no any tiredness, no any fatigue. Okay, no any stress, or no any dysphagia, no any throat, sore throat, muscle pain, no any chest pain, no any disorder, no any symptoms. That patient also having a COVID-19. That is called it as asymptomatic corona. So mainly two types. Yes, investigation. Now we enter into the investigation or diagnostic evaluation. What are the investigative measures? These are the sample tubes. Sample tube for collection of the COVID-19 sample swab collection. See the nasopharyngeal swab sample collection. They are one of the basic techniques they use for. First one, there are three techniques they use for collecting the swab sample collection: nasopharyngeal, nasal, throat swab. Okay, nasopharynx. Okay, nasopharynx technique they are used for. Yes, they are used for collecting the nasal sample collection. See, there are some procedure I am attaching for this for a good understanding for you people. See, first one I have to tilt the head, patient's head back 70 degree and insert the flexible swab, that is mini tip swab like this. Okay, like this. You have to hold here. You have to hold the tip of the swab stick. Then have to wear all the PPE, personal protective equipments, and to maintain some distance. Okay, maintain some distance and gently rub and roll the swab. Insert the shaft or insert the swab into the nasopharynx. Before performing this nasopharyngeal swab sample collection procedure, you have to know the entire anatomy of the nose, entire anatomy of the face. Where is the nasopharynx? Where is the nose? What is the nose? Where is the nose position? You have to know the anatomy of the nose, pharynx and throat. And after placing the tubes, you have to gently rub and roll the swab. Gently rub and roll the swab and leave the swab for several seconds, and then to observe the secretions for the swab, and then slowly remove while rotating it. Immediately place in sterile tube. And sanitize the all the area. Sanitize the exposing area. That's the complete or major points of collecting the nasopharyngeal swab. And this is one second one, nasal swab. Okay, nasal swab. See, this person is wearing the PPE. Okay, gloves and hand PPE, mask, all those things they have to wear the before collecting the nasal swab and also nasopharyngeal swab sample collection. Okay, this is nasal swab collection. You have to look at the anatomy. Where is the nasal cavity? Where is the nasopharynx? And where is the throat? You have to know the anatomy of the before performing swab collection. See, this is the nasal swab test. First one, nasopharyngeal, nasal swab, and also throat swab. Throat swab. You know the throat swab. You have to perform the complete all the three things: nasopharyngeal or nasal swab, and also throat swab. You have to do the both for complete polymerase chain reaction. PCR COVID-19 test. You have to include the complete two test: throat swab and also same stick used for the collection of nose. Okay, collection of nasal swab, and also throat swab. Okay, these are the both same and include the same treatment. While doing the rapid test, they only take the nasal swab collection, in some hospitals. Okay, this is the major investigations. Next, treatment. Still they are finding and still they are searching. They are searching. Okay, there are no vaccine. There are no antiviral drugs also to prevent this. Treat the human coronavirus infection. In some hospital, they are treating using some of the antibiotics, like what the treatment they are using for reducing the malaria disorder. Same treatment they are using for this COVID-19 disorder. And the number of antiviral targets have been identified, such as viral proteases, polymerases, and enteric protease. Drugs are in development which target these proteins and different steps of viral replication. To prevent this viral replication and viral development, they are giving all types of medications. It includes virus, antiviral drugs they are introducing. Nowadays, they are searching, they are finding for the treatment and preventive measures. You already know what are the preventive measures of the coronavirus. Okay, according to WHO and CDC, World Health Organization of Cities recommend the following precautions to avoiding the COVID-19. First, avoid large events, and mass gatherings, and avoid close contact. Avoid close contact. People have to know these basic things and basic manners for have to prevent, have to fight against the coronavirus, and have to live with coronavirus COVID-19. That's why I have to avoid large events, avoid mass gatherings or meetings and group discussion, group meetings, and avoid close contact. Okay, especially about you have to avoid 6 feet. 6 feet, avoid 6 feet distance, maintain 6 feet distance, and if anyone have sick, anyone have any sick, anyone any symptoms of this COVID, please maintain some distance and stay home as much as possible. And okay, stay home and wash your hands and know the 7 steps of hand washing technique. Okay, wash your hands at least 20 seconds by learning how to washing 7 hands. That's I maybe that is the my next video, that's how to wash your hand. That is a 7 steps of hand washing technique. Okay, 7 step hand washing technique using alcohol based hand sanitizer, and cover your face with mask, with cloth face mask in public places, in public spaces, especially using the N95 mask. See, it's very difficulty to wear the mask. That's why the government or WHO introducing so much face mask for comfortable of the person. Only use the non-medical cloth mask or surgical mask. N95 respirator should be reserved for healthcare providers. A surgical mask or N95 respirator that only for the who are all working in the hospital, only for that person. For you people have to wear the face mask like cloth mask, and also N95 cloth mask. Okay, N95 cloth mask cover your face once you leave your home. That's the main thing. And cover your mouth and nose with your elbow or with your tissue paper when you cough and sneeze, and avoid touching your repeatedly avoid touching your hands, eyes, nose, mouth with touching any contaminated things, and avoid sharing your tissues, your glasses, your towels, or bedding, your other household items if you are sick. And clean and disinfect item surfaces. Okay, clean and disinfect every day. You have to clean your home, your room, your toilet room, and your kitchen. And stay home from work, school, public areas. If you are sick, you don't go outside, and quarantine yourself, home quarantine like that. Like, and if you have any chronic medical condition, you definitely have to check for a COVID-19. Check with your doctor and about other ways to protect yourself. Okay, this is about discussed contents, about introduction and structure of coronavirus, and World Health Organization declaration, meaning of coronavirus, causes, mode of transmission, signs, symptoms, investigations, treatment, and preventive measures. These are the main. Okay, this is the main content. Today I explained about this COVID-19. Stay home and stay safe. If you have any doubts, ask. If you have any doubt, ask and clear your doubts, or put a question and your query on the comment box or chat box. Okay, thank you. Stay home, stay safe.